Hi everyone, welcome to Center of Balance Live. I'm Sinapua from Center of Balance, the acupuncturist. Well, it's 10 o'clock now, 10 o'clock. Well, but late today for doing this live video because I've been organizing my webinar, live webinar teaching for next month. Yeah, today I want to share with you a case which is dizziness. Treating dizziness for 10 to 20 years case. So there's a case. There's a case that he suffered from dizziness. It's not a worse dizziness, you know. I've seen people come into my clinic, they unstable and they couldn't function properly. But this case is a little bit dizziness, and that's been for more than 20 years actually. And he said recently it's getting worse. Now his one is he still can function. It just this is how he's described to me. You know, every morning he wake up and start to walk. He can feel some, you know, something unstable, but you know, oh okay, and then keep going. And then when he drive, he went to the corner and he felt, oh okay, every time drive went to corner, and that is something that very obvious every time go to corner, right? So that can be dangerous. So he know there's something's there, but he wasn't sure what's going on. So when he came to me, okay, we need to go to examination, right? So I figured out that it's actually one leg is shorter than the others. So that's causing the problem. So that is structural issues. It's structural issues. Then apart from that, and I found that he has organs imbalance. Quite a lot of other organs, especially liver and gallbladder, out of balance. Stomach and spleen out of balance as well. So now that I know that the structure is problem and organs is problem, imbalance, that's according to Chinese medicine, right? Then what did I do? I actually set up three treatment to test it out whether my diagnosis was right or not. So I set up 3 treatment, and we did for the structure. Now, I did mention a lot to you guys that that we have a lot of different acupuncture technique, right? So one of the acupuncture technique is acupuncture, which is structure acupuncture technique. With the structure acupuncture technique, is for one leg is shorter and the other one is longer, and that's causing the problem. Okay, so I got itchy nose, and then I used acupuncture for the first 3 acupuncture, and then he responded very, very well. And the first 3 treatment he got 50% better, and that was great. Then of course each treatment, apart from treating the structure, I treat the organs. With treating the organ, I choose acupuncture spirit. So the name is called acupuncture spirit, or I put it down to pulse balancing acupuncture, which through pulse, I take both hands pulse like this, and to figure out which organs are out of balance. In this case, basically I always focus on liver and gallbladder, because those 2 organs are overactive, and that is part of the reason that he got dizziness. So every time we put those 2 few needles and to rebalance the organs, to refunction the organs better. It overactive, we slow it down a little bit, right? So this is what I did. So after 3 treatment, 50% reduced. That was fantastic, fantastic. Now, then we're continuing for 8 more treatment, which is ended up with 11 treatments totally. And we did a re-examination. So after a month, we did a re-examination, and he responded to me. He reported to me that 90% better. That was fantastic. You know, this dizziness been there for 10-20 years, and it's every day, and now it's not even there. It's occasionally, you know, occasionally happen, and that's fantastic. So I want to share with you this case that dizziness, it can cause more commonly that we see in elderly patient, or there's some patient that suffer from many disease, and it could be brain problem, right? So in this case, no one knows what's going on, but in Chinese medicine, we always pick up something wrong in the organs or the structure. And what we did is, once we pick up the structure out of balance, we rebalance the structure. Once we pick up there's organs out of balance that's linked to the dizziness, then we rebalance the organs. That's how simple it is, right? So if you are a patient, or if you have friends, family, colleagues, who do you think who need acupuncture for dizziness, please get them to call us. Our phone number is 078467956, 078467956. So we'll be able to help them. And if you're an acupuncturist and you're watching this video and you would like some help, please leave your name down there, and I'll send you over some free balance method acupuncture that video. That's recording one. It's free and you can learn it yourself. And balance method acupuncture is one of my acupuncture technique that to treat dizziness as well. But in this case, I didn't use balance method acupuncture because it works very well with GE acupuncture and acupuncture spirit. But if it doesn't work well with those two techniques, and I'll go ahead and add on balance method acupuncture. So again, I have a lot of different techniques, and I always test it out which one works better and which one that patient actually responded better. Right? Stay awesome, and I'll see you next time. Bye bye.